My name is Drew Cannon. I'm working here as a therapist in the outpatient department at Salt Lake Behavioral Health. I've been working in the mental health and substance abuse programs and areas for over 40 years. Addiction in my life has changed quite a bit in my outlook and the theories of addiction. Currently, I believe that addiction is a disease. I believe it's a chronic disease. I believe that our biggest problem we have with addiction is society's attitude towards it and families' attitude towards it, believing that it's a moral issue, that something's wrong with the person, and yet they ignore this disease factor of it. I believe not only that it's a disease, but I believe that it has a very good treatment. Though simple in form, it's complex in its treatment and recovery. When people go into detox or stabilization on an inpatient basis, they complete that in 5 to 10 days. Then what? They go to a residential program and stay for 30 days. Then what? Well, the IOP, or Intensive Outpatient Program here at Salt Lake Behavioral Health, is the answer to that. We're the then what. And it's not just for a month or two. It can be several months to get people stabilized so they can start to manage their disease on their own and enjoy that life that they deserve. Here in Salt Lake Behavioral Health, IOP, we treat addiction as a follow-up following detox. We first get people's minds straight through the detox, and then what do we do after that? A person in addiction needs to learn a plan on how to manage this disease they have. They need to learn what they do when they have triggers and urges and cravings for their substance, and rather than turning to that, to turn something else that's not destructive but constructive in their lives, and they become healthier. This is a lifestyle. It's changing from old reactions to new reactions, and I like to refer to it as a management plan of risk, that when they're at risk, they know what to do to manage their disease. IOP helps people develop a management of risk to prevent any relapse in the future. And they do it not alone. They do it within a group setting. And for many people, this is the first time that they get with other people very similar to themselves, and they don't feel alone and isolated. They don't feel like they're ignorant or of less of a person. And they learn not only from the education that they get there about the disease and coping skills, but they also learn from others in the group how they cope and how they manage their disease to be more successful.